This lecture will cover attenuation artifacts. Attenuation artifacts are going to make up most of the artifacts that are helpful in diagnosing different diseases. They are going to deal with how sound acts once it gets into the body and how it attenuates. The four main attenuation artifacts that you'll need to know are shadowing, edge shadowing, enhancement, and focal banding. So shadowing occurs because sound cannot pass through a structure due to a very strong reflector with high attenuation in the beam path. True anatomy is obscured by a hypoechoic or anechoic region. This is considered an artifact because of the loss of information deep to the strong reflectors. We're invalidly assuming that the echoes are correct brightness for the tissue's characteristics. Again, shadows can be helpful to diagnose. In our example off to the side here, we have a fetal profile, and the skull and nasal bone and maxilla or mandible and the maxilla have all started to ossify, which makes the sound coming through attenuate much quicker. It just kind of gets absorbed by the bone and nothing can really pass through it. So what we tend to get behind that are these really dark shadows behind bone. We'll see it commonly behind gallstones, anything that really makes that sound highly attenuate. That shadow comes in because there just isn't any sound getting to the area. We consider it an artifact because we know there's more baby back here. This just isn't a big fetal or a big cyst hanging out back there. So we consider it an artifact because the tissues that are back here are not being displayed at the correct gray that we would expect. As I've mentioned before, sometimes we want to leave shadows because they are helpful in diagnosis, especially with, again, back to gallstones. If we have our gallbladder here and we have these bright structures within, if they have a shadow behind it, we start to think that that could actually be a gallstone because that is typical ultrasound appearance of it. If we're not seeing anything behind it, then we might think that it is a polyp, as it's just kind of a soft tissue structure within the gallbladder, not a stone. Both, they are treated very differently, so it's important that we are able to differentiate between structures that look similar. To correct for shadowing then, we're going to want to change the angular path that we're coming in at the anatomy. Maybe we'll take extra pictures around the shadow, moving to one side where that shadow is not as apparent, or maybe we'll leave it because it helps with diagnosing. Edge shadows are a little bit different in that edge shadows occur as we're imaging past a curved structure, causing the sound beam to refract and diverge at the same time. So this results in very quick attenuation and shadowing from the edge of a circular structure. This is going to decrease the intensity of the sound beam. Edge shadows appear as hypoechoic areas, deep to a curved edge, and these are going to run parallel with the sound beam. Again, this is considered an artifact because the shadow is obscuring true anatomy. So as the sound is coming in to the body, it's hitting the edge of the circular structure here. As it hits it here, it's going to refract. So some sound's going to shoot off this way and diverge at the same time. Some sound is going to head other ways, and what we get is this very obvious line of shadow off of the edge of the curve. Again, it's because sound is simultaneously refracting and diverging, which means that all of a sudden we have a large dropout of intensity of sound. Quick attenuation through there, so we get those shadows. Again, to correct it, we're going to want to get away from those edges of the circular structure by changing our path or our angle, or try to image around it. Enhancement, on the other hand, though, is when sound beam passes through a structure with abnormally low attenuation. This is going to make tissue appear brighter deep to the structure than the surrounding tissue. We're going to see the correct structures behind these enhanced areas. They're just going to be displayed overly bright. Again, this is invalidating the assumption that echoes received are appropriate. Sometimes this is also helpful in diagnosis. So for example, we have a simple cyst here. One of the key diagnosis parts to a simple cyst is that we have through enhancement. So it's this really bright area that's coming out from behind that cyst. Sound is not traveling any faster through this area It's just that the cyst is not making the sound attenuate at all. Where it attenuates through other solid tissues, it just doesn't attenuate through fluid-filled structures. So typically behind those fluid-filled structures, we expect to see this area of enhancement. The other important part is that we can typically see structures that sit behind our fluid-filled areas. They just end up being the wrong brightness. This is especially true of bladders and uteruses. We have a bladder, fluid-filled structure, and behind it is the uterus. Typically what happens is our bladder is completely anechoic, and right behind it we're going to have really bright uterus. We can still see that it's uterus, but then we use our TGCs to kind of correct for that brightness and kind of even everything out. But that enhancement behind cystic structures is considered an artifact. Sometimes it does help us in the diagnosis. Again, simple cysts should have enhancement behind them. Without it, then we might think that this is a solid hypoechoic area that might need further looking into. To correct it, again, we're going to change our angle or path. We're going to take extra pictures around the enhancement, or we might decide to leave it for diagnostic purposes. The last attenuation artifact that you need to know about is called focal banding. This is going to appear at the level of the focal zone. Brighter reflectors are going to come across the picture, kind of side to side of the sector. This might look like a TGC has been displaced, and it's caused by an increased intensity at the focal zone. So we can see our focal zone is placed here, and right at the level of that focal zone is this little bit brighter hyperechoic band going side to side of our sector field. If we moved our focal zone up, then we would expect to see that band travel with it. It really does kind of look like a displaced TGC to the brighter side. To fix this, we're going to widen our beam, so maybe drop our TGC a little bit lower, reduce the intensity of where that is, or we're just going to take our TGCs and correct for it to even out at the level of the focal point. All right, so relatively simple concepts, things that you've been seeing all along in your pictures most likely. You just need to realize that they are considered artifacts, even though we do help them or use them for diagnosing certain diseases. Make sure to understand that it is not a matter of sound moving faster or slower, that it is truly the rate at which the sound is attenuated will affect shadowing versus enhancement. So number one, why do we consider attenuation artifacts to be artifact? What assumption do they violate? Number two, which attenuation artifacts are helpful and why? Number three, think of a question that you may have about this lecture that you would like some further clarification on.